how many marijuana deaths have there been in the last 5 years?
So if you're referring to overdoses, I am not sure of those numbers. If you're referring to fatalities,
then I would like to have you supply us with how many overdose deaths there were.
Furthermore, according to a study published in the British Columbia Mental Health and Addictions Journal, health-related costs for alcohol consumers are 8 times greater than healthcare costs for cannabis users. In fact, researchers at the Boston Medical Center and Boston University School of Medicine found that cannabis does not increase users' frequency of hospital visits. Their findings were based on a study of 589 adult cannabis users. More shockingly, according to the CDC, someone dies of a prescription drug overdose every 19 minutes in the United States, while Canada does not even keep track of prescription drug death statistics. However, in the past decade, hundreds of Canadians have been killed by Tylenol, while tens of thousands more have been hospitalized by the over-the-counter painkiller, according to Statistics Canada. In the US, Tylenol causes about 458 deaths, 56,000 emergency room visits, and 26,000 hospitalizations annually.
What's more dangerous and what is more addictive? Cocaine and meth or marijuana? Pretty simple.
I think that conversation minimizes the harm.
No, I'm not trying to minimize the harm. I want to know which is more dangerous and addictive.
Again, I go back as as a public health person. One of the things that we look at is not what's the relative risk of one drug.
Okay. Let me just say that I think that your equivocation right there, being unable to answer something clearly and definitively when there is unquestioned evidence to the contrary, is why young people don't believe the propaganda, why they think it's benign. If a professional like you cannot answer clearly that meth is more dangerous than marijuana, which every kid on the street knows, which every parent knows, if you can't answer that, maybe that's why we're failing to educate people about the dangers. I don't want kids smoking marijuana. I agree with the chairman. But if the deputy director of the Office of Drug Policy can't answer that question, how do you expect high school kids to take you seriously?
While most scientific evidence suggests cannabis is relatively safe and in many cases beneficial for adults, some studies indicate youth under 18 may see mental declines with heavy cannabis use. For example, a study by researchers at the University of Otago in New Zealand found teens who regularly consume cannabis risk a long-term IQ drop. More than 1,000 subjects were tested at 13 before any significant cannabis use, then again at 38. It is important to note that the decline was not found in people who started using cannabis after age 18. Furthermore, a study of 97 teens by Northwestern University found cannabis may alter the working memory of adolescents that use the drug heavily. However, the group of 16 to 17-year-old users studied used cannabis daily for 3 years to negatively impact their memory.